Hello, hi everyone. My name is Dr. Sana Khan, your biology expert, and you're watching my channel Neat Biology Unplugged. So today we are going to talk about cancer. I know I have not covered up the immunity part. I'll be soon covering it up. But in today's lecture, we are going to talk about cancer. Cancer is one of the very important topic for your NEET as well as for your boards. So boards are coming now. It's approaching. So I hope you all are preparing for your board. Soon I'm going to come up with the most important questions for each chapters for your 12th standard. So it will be really helpful for you to study. Okay, so without wasting time, let's get started and talk about cancer in today's lecture. So cancer. See, the cancer is one of the topic which is given in your chapter where they have explained cancer in very much detail, right? So it can be asked as a long question also, or it can be asked in subjective and objective questions. So let us define cancer. So cancer is a class of disease characterized by, sorry, out of control cell growth. Okay, so what is cancer? Cancer is a disease where the cell grows out of control. Means the multiplication, the proliferation of cell is out of control, and it is a kind of non-communicable disease. So it's a non-communicable disease where the proliferation or multiplication of cell is uncontrolled. Okay, so जैसा सेल डिवाइड होना चाहिए वैसा डिवाइड नहीं होता है. एक सेल जो भी कैंसरस सेल में टर्न हो जाता है. ओके पहले तो क्या होगा, पहले आपका जो नॉर्मल सेल है दैट विल टर्न इनटू अ कैंसरस सेल वेयर यू कैन सी ओवर हियर इन द स्क्रीन द ग्रीन कलर. So initially the cell will turn into cancerous cell and that will undergo multiplication. Okay, वो uncontrolled multiplication दिखाएगा. Can you see it on the screen? So it will undergo uncontrolled multiplication and it will damage the body. Okay, it will harm the body and it will form a lump or a mass of a tissue. So एक सेल पहले कैंसरस सेल में टर्न होता है, फिर वो अनकंट्रोलेबली मल्टीप्लाई होकर एक ग्रुप ऑफ मास सेल बनाता है या फिर लम्स बनता है. Okay, so there is a formation of lump or mass tissue and that is called as tumor. What is it called? It is called as tumor. So what is tumor? When a cancerous cell multiplies uncontrollably and it forms like a mass. Okay, there would be a protective covering. So when it forms like a mass, it's called as tumor. So tumors can grow and interfere with any of your system. Okay, tumor कहीं पर भी grow हो सकता है और आपके कोई भी system के साथ उसके normal function के साथ interfere कर सकता है. If it is developing in nervous system, so it will affect the normal functioning of nervous system. अगर वो आपके digestive system, circulatory system, respiratory system कहीं पर भी develop होगा तो उसके normal function के साथ वो hamper करेगा. Okay, and plus ये जो tumor cells होते हैं they can also release abnormal hormones that will alter your body function. Okay, I hope everybody is clear with what is tumor. तो एक सेल जब uncontrollably multiply करता है, okay, but it is still protected with a sheet. उसके आजू बाजू एक covering होती है जो उसको spread होने से बचाती है. So that is called as benign tumor. And ये tumor कोई भी body part में जब develop होता है, it interferes with different system. Okay, plus it also have an ability to release hormones which can alter the body functions. Now, in case of leukemia, you must have heard about this cancer. Leukemia, commonly हम इसे blood cancer कहते हैं. तो ये cancer inhibits normal body function by abnormal cell division in bloodstream. तो ये leukemia, that is blood cancer में क्या होता है, जो आपके WBCs होते हैं, see these are the pathological. Okay, WBCs में there is certain abnormalities and ये WBC uncontrollably multiply करते हैं जिसकी वजह से जो normal function है वो भी hamper होता है and that's called as leukemia. We'll also be studying about leukemia in detail जब हम types of cancer के बारे में आज discuss करेंगे. Okay, so अभी जब ये cancer cell limited है, okay, when it is showing a limited growth, it's called as benign tumor. But what happens after, and see, can you see over here, it is enclosed in a sheet. Okay, so they stay in one spot and that is called as benign tumor. But what happens, can you see, this cancerous cells manages to divide because they have an ability of dividing very fast. तो जब ये cancerous cell divide होते हैं और अपनी खुद की ब्लड वेसल बना लेते हैं, ये लोग क्या करते हैं, ये लोग अपनी खुद की जब ब्लड वेसल्स बना लेते हैं तो उस ब्लड वेसल पे दे स्टार्ट फीडिंग. Okay, and then they multiply very, very fast, and then they spread. So when they form their own blood vessel, that is called as angiogenesis. क्या कहते हैं हम उसको? Angiogenesis. So cancer cell multiply होते हैं, फिर अंदर खुद के ही blood vessel बना लेते हैं, and that procedure, that thing is called as angiogenesis. And through the blood vessels which they have formed, अब उन्होंने खुद की blood vessel बना ली हुई है, correct? So अब वहां से वो spread होते हैं throughout the body, that is through blood or lymph, and they destroy even your healthy tissue. So when they start spreading, okay, जब वो spread करना शुरू हो जाते हैं, that is called as invasion. Then this is very, very dangerous condition, because जब एक ट्यूमर एक जगह पर होता है, it's easy to remove it, but वो जब खुद की blood vessel को grow करके इधर उधर spread out हो जाता है, healthy tissues पे चला जाता है, तो वहां पर भी वो effect करने लगता है, and that is called as invasion. See, this is how they spread. You can see it in the image. Can you see how it's spreading like this? Yes. So through blood vessels and lymph, it's spreading, and वो spread होके वहां पर multiply करता है, and that organ gets destroyed. So this tumor successfully spreads to other parts and grows and destroy the healthy tissue. And that stage is called as metastasis. What is it called? Metastasis. So understood, जब एक जगह पर ग्रोथ होती है तो उसको बिनाइन ट्यूमर कहते हैं, जब वो स्प्रेड होता है तो उसको मेटास्टेसिस कहते हैं. और वो क्यों स्प्रेड होता है? बिकॉज वो खुद की ब्लड वेसल बनाता है, जिसको हम एंजियोजेनेसिस कहते हैं. सी दीज स्मॉल स्मॉल टर्म्स आर इंपॉर्टेंट, ये आपको नीट में पूछे जा सकते हैं, बोर्ड्स में पूछे जा सकते हैं, ठीक है. एंड दैट इज कॉल्ड एज मेटास्टेसिस. नाउ कमिंग टू द अनदर टाइप ऑफ ट्यूमर, दैट इज मैलिग्नेंट ट्यूमर. So what happens, sorry for the throat, जब आपका बिनाइन ट्यूमर इन्वेजन करने लगता है, खुद की ब्लड वेसल बनाने लगता है, एंड वो जब मेटास्टेसिस करता है, दैट टाइम वी कॉल इट एज मैलिग्नेंट ट्यूमर. दिस इज अ वेरी डेंजरस कंडीशन, ठीक है, बिकॉज ट्यूमर हर जगह स्प्रेड हो गया है, दूसरे ऑर्गन्स, दूसरे टिश्यूज पे जाके इट हैज ऑलरेडी स्टार्टेड अफेक्टिंग, ठीक है. तो वहां हर ऑर्गन में कहा गया है, उसको निकालना इट्स वेरी वेरी डिफिकल्ट. सो जब वो चीजें मैलिग्नेंट स्टेज तक पहुंच जाती है, तो सर्वाइवल रेट ऑल्सो बिकम्स वेरी difficult. So malignant tumor undergoes metastasis, and it is very, very dangerous condition. So now let us classify, let us differentiate between the benign and malignant tumor. So benign tumor is a one which stay in one spot. Malignant is a one which moves throughout the body using blood and lymph. So benign will show the limited growth. It will rapidly, the malignant one will rapidly divide, and it can be capable of angiogenesis. It doesn't, benign will not show invasion, malignant will show invasion, and benign will does not undergo metastasis, while malignant will undergo metastasis. So these are the two different types of tumor which you can see in case of cancer. And the physicians and the research who are specialized in study, diagnosis, and treatment of cancer are called as oncologists. What are they called? Oncologists. So I really hope that whoever is watching the videos, once they clear their MBBS, they can go for your further studies, and you can even become oncologist. It's a very, very good field where you can help out with people with cancer. Okay, so physicians who handle the cases of cancer, those are called as oncologists. Okay, so now let us talk about the stages of cancer. So we know the two types of tumor in our body which gets developed, that is benign and malignant. Now let us proceed to the next one, that is stages of cancer. तो स्टेज 1 जो होता है उसको हम कहते हैं टी स्टेज या फिर ट्यूमर स्टेज हम कहते हैं. तो टी स्टेज या ट्यूमर स्टेज इज अ वेरी सिंपलेस्ट फॉर्म, ठीक है, काफी सिंपल होता है. सिंपलेस्ट फॉर्म इन द सेंस यहाँ पर जो ट्यूमर है इट्स वेरी वेरी स्मॉल, okay, and it is confined to the organ or tissue of its origin. तो जहां पर भी वो सेल, जहां पर भी एक नॉर्मल सेल कैंसर सेल में डेवलप हुआ था, वहीं पर वो रहेगा. इट विल बी confined, it will be its area of that organ या टिश्यू जहां पर वो बना था. एंड दिस इज अ बेस्ट चांस ऑफ क्योर एट दिस स्टेज. सो अगर कैंसर ये स्टेज में डायग्नोस हो जाता है, टी स्टेज में, दैट इज स्टेज 1, जहां पर कैंसर सेल एक ही जगह पर है, कंफाइंड है, तो उसको ट्रीट करना इजी होता है. Let us come to the second stage, that is stage 2. तो यहाँ पर you can clearly see, यहाँ पर थोड़ा से जो cells होते हैं they start spreading. Okay, तो they spread to the adjacent tissues. And stage 3 जो होता है that's called as end stage or nodal stage. So यहाँ पर जो tumor होता है that spread into surrounding tissues and lymph nodes. So यहाँ पर angiogenesis होना शुरू हो गया because it's spreading to different tissues, it's spreading to different lymph nodes. matlab they have already formed their own blood vessels and they have started multiplying and spreading throughout the body. And finally is the stage 4 where it's a more extensive spread, मतलब वो maximum organs तक पहुंच चुका है, maximum body parts को destroy कर चुका है. Is it clear? So these are the 4 stages of cancer. Stage 1 is the best time to cure a person from cancer, because here the cancer is only limited. Can you see? The cancer is only limited to that point. But stage 2 में भी थोड़ा difficult है, because वो adjacent tissues में spread हो गया है. Stage 3 में it has spread to different tissues, lymph node. And stage 4 में the survival rate is very, I would say like no, because most of the organs have already been destroyed and spread by the cancer cells. Okay. So these are the 4 stages of cancer. I don't know why it's got repeated. So now let us come to the classification of cancer. So we are done with 2 things now, benign and malignant tumor stages of cancer. And now we'll be talking about the classification of cancer. So there are over 100 types of different cancer, but obviously it's not difficult. Right? जैसे कि टिश्यू वाले चैप्टर में बहुत सारे सेल्स है, 200 टाइप्स के सेल्स है, तो उनको पढ़ना इजी नहीं था, तो हमने क्या किया था, उनको टिश्यूज में डिवाइड किया था. राइट? सो सेम वे कैंसर को भी हम 5 मेन ब्रॉड कैटेगरीज में डिवाइड करेंगे टू अंडरस्टैंड अबाउट देम. सो द फर्स्ट वन इज कॉल्ड एज कार्सिनोमा, सेकंड वन इज कॉल्ड एज सार्कोमा, थर्ड वन इज कॉल्ड लिम्फोमा, fourth is called leukemia, and the fifth one is called as adenoma. I repeat, so there are how many types of cancer? There are 5 broad groups of cancer, I would say: carcinoma, sarcoma, lymphoma, leukemia, and adenoma. Okay, so these are the 5 broad groups of cancer. Now let us talk about each one in detail. So first we are going to talk about the carcinoma. So carcinoma क्या होते हैं? Cells that cover internal and external parts of the body. तो अगर cancer, okay, if the cancer has spread, if the cancer has developed in your internal and external part of the body where there is an epithelial tissue, that will fall under the category of carcinoma. Is it clear? Are you getting it? So what is carcinoma? Cells that cover internal and external parts of the body where there is an epithelial tissue, that is called as carcinoma. So the examples over here are breast cancer, lung cancer, colon cancer are the common examples. You already know that women are more prone to breast cancer, right? So yes. So breast cancer is a kind of epithelial tissue cancer. So carcinoma is the cancer of your epithelial tissue. Coming to the next type, that is your melanoma. So melanoma is also a kind of your epithelial tissue cancer only. So यहाँ पर क्या होता है? There is a cancerous growth of melanocytes like this. Okay, melanocytes जो cells होते हैं, okay, which secrete melanin, उनकी ये देखो कैसे growth हो जाती है. So that leads to melanoma, which is a kind of carcinoma. Now coming to the next one, that's sarcoma. Sarc आपने पढ़ा है ना? Sarc means what? Muscles, right? Sarc means the skeletal muscles. So the cells which are located in bone, cartilage, fat, muscle, and connective tissues are called as sarcoma. So sarcoma means cancer of any part of your body which is related to the bone, cartilage, fat, muscle, in short connective tissue. Okay, जैसे कि carcinoma is a cancer of epithelial tissue, वैसे ही sarcoma is a cancer of connective tissue. Then comes your few examples, like when it is adipose tissue cancer, it's called as lipoma. And when it is bone cancer, it is called as osteosarcoma. Now the third type is the lymphoma. So lymphoma is a cancer of lymph nodes and the tissues of immune system. So when a person is developing cancer in the lymph nodes or in the immune system cells, that's called as lymphoma. So the example of lymphoma is Hodgkin's disease. The example is Hodgkin's disease. And the next one, the fourth one, sorry, that's called as leukemia, which I already told you. Leukemia means cancer of blood. Okay, so यहाँ पर क्या होता है? It's a problem in the bone marrow itself. So it starts beginning in the bone marrow and it accumulates in the bloodstream. So bone, obviously WBCs are produced by the bone marrow, correct? So यहाँ पर जो problem होती है वो bone marrow की होती है. So it starts producing abnormal WBCs, which gets increased a lot, multiply a lot, and ultimately a person develops a blood cancer, which is called as leukemia. And the last one is adenoma, which is a cancer which arises in the glandular tissues, like in your glands, like your thyroid gland, pituitary gland, adrenal gland, any of the gland. Okay, so when the tumor develops in any of the gland, that's called as adenoma. Okay. So that's all the 5 groups of cancer which you should know. So the first one which we studied was uh, about the epithelial tissue, that is called as carcinoma. Then connective tissue, that is called as sarcoma. Then आपका आता है blood का cancer, that's called as leukemia. Then comes your adenoma, that is your cancer of your glands. Okay, so there are 5 total groups of cancer which you should be clear. Is it getting clear? Is everybody clear? I hope I'm not going fast. I hope so. So I have talked about first 2 types of tumor, that is benign and malignant. Then we have talked about few terms like angiogenesis, metastasis, and all those stuff. And then we talked about the different groups of cancer. Now let us understand what is the cause of the cancer. ऐसा क्या हमारे normal cell में होता है कि हमारा normal cell cancerous cell बन जाता है? Let us understand the reason of cancer. See, there is immediately ऐसे अचानक से कोई भी body में cancer cell develop नहीं होते. Okay, there are multiple mutations which are needed to create a cancerous cell. आपके सेल में मल्टीपल म्यूटेशन होना चाहिए, मल्टीपल चेंजेस होना चाहिए, जिसकी वजह से जो सेल है वो कैंसरस सेल में डेवलप हो जाएगा. Okay, and it will grow uncontrollably. So now mutations are caused by what? ये mutations, ठीक है, हमें इतना पता है कि कैंसर सेल में mutations होने चाहिए, right? So ये mutations होंगे कैसे? ये mutations होते हैं by the agents which are called as carcinogens. What are they called? Carcinogens. So carcinogens वो factors है जिसके वजह से जो हमारे सेल का डीएनए होता है, it starts showing mutation. So what are carcinogens? These are cancer causing factors which cause mutation in the DNA. And these factors could be anything, like it could be physical, it could be chemical, it could be biological as well. So carcinogens are those which shows, because of which there is a mutation in your DNA and the normal cell undergoes a change and become a cancerous cell. So physical mutations में क्या आते हैं? Let us see. There are, which are the physical mutations which can damage your DNA? The first one है ionizing radiations like X-rays, gamma rays. You must have heard ना, बहुत लोगों को आपने सुना होगा कि ज्यादा भी unnecessary हमारे bodies में X-rays वगैरह नहीं होने चाहिए, because those X-rays have a tendency to show mutation in our DNA. Non-ionizing radiation, that is UV rays, जिसको आज हम prevent नहीं कर सकते हैं, UV rays, right? That is one of the natural cause. That is why the cancer is so prevalent nowadays. Natural mineral fibers like asbestosis could be the another one of the reason for physical mutations. So these are the physical mutations which can lead to the damage in DNA and cause mutations. Now what are the chemical mutations? So chemical mutations में होता है पहला benzopyrene, which is found in coal tar and cigarette smoke. Okay, so the person who smokes a lot, उनके अंदर ये बेंजोपायरीन पाया जाता है, जिसके वजह से जो हमारा डीएनए का ग्वानिन होता है ना, that starts unpairing properly. तो उसका pairing जो साइटोसिन के साथ होना चाहिए वो नहीं होता है. So that's a mutation which is taking place because of cigarette smoke, and that is a reason for the lung cancer to develop. Then come vinyl chloride. तो vinyl chloride plastics में पाया जाता है. ऐसे ही the government has not come up with no plastic things, because plastic की चीजों में ये vinyl chloride पाया जाता है, जिसके वजह से it could be one of the reason, but it could be one of the reason for chemical mutations as and developing a cancer. Then comes the aflatoxin, which is found in fungi, heterocyclic amines which are found in overcooked food, dyes like ethidium bromide, mustard gas. These are the various chemical mutations which can lead to the damage in or mutation in DNA. So these are the carcinogens, but chemical carcinogens which causes change in the DNA. Okay. So now let us go further and talk about the biological. So biological obviously आपकी viral या bacterial होंगे. So there would be certain viruses. Once if a person gets infected with certain viruses and bacteria, it could also lead to cancer. So viruses can transform normal cells to cancer cell by various different mechanisms. So there are various viruses which can later on lead to cancer in human body, जैसे कि papilloma virus, which is very common cause of cervical cancer, hepatitis B virus for liver cancer, and T lymphocytic virus for lymphoma. So even the viruses could be one of the cause for the cancer. Harald Zur Hussain got Nobel Prize in Medicine for identifying papilloma virus as the cause of cervical cancer. See, cervical cancer was one of the very, very common cancer developing in females. Okay, so at that time it was not noticed that it was because of papilloma virus. So he was a person who recognized about this papilloma virus. And let us talk about few bacterias which are associated with cancer. So the first one is Helicobacter pylori, which is the common reason for stomach cancer. So these are the various viral and these are the various biological carcinogens. ठीक है, so carcinogens कौन से types के हमने पढ़े? Physical, chemical and biological, which can cause mutation in DNA and lead to cancer. Okay. Now, cancer-causing mutations are in genes that regulate cell growth and repair DNA. तो अब ये जो cancer-causing gene है, ये होती कहाँ है? See, first of all, try to understand that each and everybody of us have these things. They can develop cancer. Okay, so it can lead to a cancer because we have cancer-causing mutations. We can get exposed to these mutations. So cancer-causing mutations are in genes that regulate cell growth and repair DNA. तो ये mutations कौन से part of हमारे gene में होते हैं कि वो part में होते हैं जहां पर cell growth हो रही है या DNA repair हो रहा है, वहां पर it takes place. Okay. So वहां पर it takes place. So now cancer gene can be categorized as oncogenes. What can be it categorized as? It can be categorized as oncogene. Now try to understand this mechanism to understand how does the exactly cancer develop. See, this is a normal cell having proto-oncogene. Everybody of us have proto-oncogenes in us. ठीक है, हमारे सेल के डीएनए के जीन में प्रोटो-ऑन्कोजीन होता है. Proto-oncogene is inactive. See this one. Can you see it in the image? जैसे ही कैंसर कॉजिंग एजेंट ये प्रोटो-ऑन्कोजीन पे पड़ता है, it becomes activated like this and it changes the physiology, pathology, everything about the cell and become cancerous. So proto-oncogene is present in each and every body. ठीक है, तो जब किसी को भी जब anybody is exposed to carcinogen, वो carcinogen कैसे भी हो सकता है, बैक्टीरियल हो सकता है, वायरल हो सकता है, केमिकल हो सकता है, फिजिकल हो सकता है, तो वो carcinogen की वजह से ये proto-oncogene activate हो जाता है and cell become cancerous. Okay, so normal cell gets transformed into cancerous cell. So now let us talk about the clinical features of cancer. So now we know the cause of the cancer, that is carcinogen, right? We know that proto-oncogene सब में होता है, then because of carcinogen it get converted into oncogene. Now let us talk about the clinical features. What could be the symptoms? What could be the problems a person would face if he suffers from cancer? See, first of all, cancer is a very big term. ठीक है, कैंसर कहीं भी बॉडी पार्ट का हो सकता है. तो वो जिस बॉडी पार्ट का होगा जहां पर कैंसर सेल होंगे, जिस साइज का वो कैंसर होगा, उस पे डिपेंड होता है कि व्हाट कुड बी द क्लिनिकल फीचर्स. सो क्लिनिकल फीचर्स टोटली डिपेंड ऑन द लोकेशन एंड द साइज ऑफ द ट्यूमर प्लस हाउ मच इट हैज स्प्रेड. ठीक है, वो कितना स्प्रेड हुआ है उससे उसकी सिवियरिटी और उससे उसके सिम्टम्स भी डिपेंड होंगे. So some cancers can be felt or seen through skin like lump. Okay, skin पे अगर lump develop हो जाता है तो वो lipoma भी हो सकता है, but it could be cancer as well. So lump on the breast or testicle could be something which you can see. So there are certain cancers which you can see. If the person is developing lump in the throat or lump in the skin, that could be a cancer. Then melanoma, that is a skin cancer. Okay, तो कोई भी अगर mole, what में, if there is a color change, then it's a cancer. It's often noted by change in what or mole of a skin. And oral cancer can also be seen like this. There would be a thrush like this. Okay, white spots of thrush in the tongue. So that these are the few cancers which you can recognize by seeing, few symptoms by which you can recognize that the person is suffering from cancer. Apart from that, there are certain common symptoms of cancer like nagging cough or hoarseness, thickening or lump in any part of the body, changes in bowel habit, a sore that does not heal, changes in wart or mole, then indigestion and difficulty in swallowing, unexplained changes in weight, unexpected loss of appetite, and unusual non-injury bleeding and discharge. So if there are many of these symptoms found in the body, then that could be the reason of cancer. It's sometimes the cancer is the same thing which you can even not notice. Okay, it can be not noticed for months, it cannot be noticed for a year, and that is a problem because it spreads then, and then survival rate becomes very less. So these are the common symptoms which can be seen in a person who is developing cancer. Okay, and it should be noticed. Specifically if I talk about the unexplained change in weight, okay, ये जो weight loss होता है अचानक से body में, it's actually a very 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 alarming sign. ठीक है, weight loss could be there because if you're not eating, if you're exercising, that is a normal thing. But agar if you're living a normal life and then also you feel like okay there is an unexplained weight loss and there is no appetite, that is one of the alarming signs for few big diseases like tuberculosis ho gaya, aapka AIDS ho gaya, cancer ho gaya. These are the big diseases which show such alarming signals. So you have to be very particular about it. And when cancer spread or metastasize, there could be some additional symptoms depending upon the area which has been affected. Because if the lung is affected, the person will get symptoms of lung. If the brain is affected, the person will get symptom of brain. Okay, there would be certain enlarged lymph nodes which would be present, which should be recognized. And unusual, unusual swelling in the entire body is something which is also one of the very important clinical features. If it is metastasizing to the brain, the person may always suffer from headache, vertigo, seizures. Okay, this could be the common symptoms a person would have if it metastasizes to the brain. अगर lungs में spread हो रहा है तो symptoms could be like shortness of breath, there would be difficulty in breathing, hoarseness, there would be coughing, because it has spread to the lung, it has spread to the lung, वहां पर lungs के symptoms develop होंगे. अगर liver पे spread हो रहा है तो it may lead to jaundice, it may lead to hepatomegaly, that is enlarged liver. So wherever it is spreading, it will produce the symptom of that organs, that specific organ. Okay. If it has spread to the bone will become weak, the bone will become brittle, they will be painful. So cancer symptoms actually is not very particular. It actually depends कि वो कौन से body में develop हो रहा है, कौन से stage पे, because we have talked about the stages of cancer. Okay, and plus you will be having few symptoms which I mentioned in the earlier part. So now, okay, the person has developed cancer. Now, how will you detect it? How will the cancer get diagnosed? See, early detection of any of the disease, I would say, is very, very important. But when it comes to bigger diseases like cancer and AIDS, अगर ये diseases जल्दी recognize हो सके, diagnose हो सके, तो ऐसे cases में survival rate बहुत ज़्यादा हो जाता है. So it's very, very important that it gets detected early. For that, we can go for bone marrow biopsy, because bone marrow biopsy में you would be able to see the abnormal WBC count. Tissue biopsy, if a doctor has a suspicious कि okay ये वाले part का cancer है, then वो tissue की biopsy से it could be clear. Okay, or endoscopy. In case of cervical cancer, we can go for pap test, that is pepinoculua test. Okay, which is just staining for detecting cancer. We take a cervical cells to understand whether they have undergone a cancerous changes or not. Apart from that, you can go for CT scan, MRI, which is also useful to detect the cancer of internal organs, and radiography using X-rays. These are like less common things which can detect cancer, but CT scan and MRI is one of the very, very good detection tests for cancer. So now what happens when you go for a test like PCR or microarray? So use of molecular biologies like PCR test we have already discussed in biotechnology. They can also be used to detect the cancer, because from that you can diagnose the antibodies which our body gets developed because of the cancer. So it detects that antibodies. So these are a certain set of tests which you can do to diagnose cancer. But what could be the treatment for cancer? So treatment will depend obviously on the stage of the cancer, on the type of the cancer, okay, how much it has spread. So treatment will also depend upon the age of the patient, upon the health status of individual. The treatments could be like surgeries, Okay, so treatment could be like surgeries. Obviously, if specifically if I talk about a benign tumor, if it's a benign tumor, surgery is one of the best option because it's a limited tumor, you can remove it, and the survival rate is very, very, very high in this case. So initial treatment is first the doctors try to remove those cancer cells with the help of surgery. Apart from surgery, you have to give radiation therapy. The like high energy X-rays are used to destroy the cancerous cells. Okay, there are certain elements which can be used. Then this is called as gamma knife. Gamma knife is also one of the procedure. It's a type of radiosurgery for destroying brain tumors using gamma rays produced by cobalt 60. Okay, so cobalt 60 से जो gamma rays produce होते हैं उससे वो target किया जाता है cancer cell को and वहां पर उसको destroy किया जाता है. Apart from that, chemotherapy, जो शायद आपने सुना होगा about it, it's the use of chemicals or medicine. It's an anti-cancer drug which help in the treatment for cancer. Okay. So these are majority of the treatments which a person undergoes. But with the treatment, there are lots and lots of side effects which a person face, like hair loss, anemia. आपने देखा होगा, you must have seen in the movies, you must have seen in the real life, in fact, कि a person who suffers from cancer, they have to take a very high dose of medicines. So उसका side effect भी they face a lot. So one of the very common side effect is hair loss. Even the hair loss is so much that even they lose their eyebrows also sometimes. Okay, so hair loss hai, anemia hai, lot of weakness could be there. So we give alpha interferons also in the patients to destroy and to boost up the immune system. Sorry, to boost up the immune system. So immunotherapy is also given so that it's based on the increasing the body's ability to recognize the cancer cell and destroy them. So it tries to destroy the cancer cells. Apart from that, you can give gene therapy and hormone therapy. See, you do not need to learn the treatment. First of all, always remember, in case of human health and disease chapter, you need to remember the treatment. I'm just discussing a treatment in short, just for inquisitive, to just for you all to know that what happens in the treatment of cancer. That's it. That's why I'm not mentioning it into very much detail. So for so here there is no single treatment for cancer. There has to be combinations like surgeries, chemotherapy, and a lot of palliative therapy need to be given. So that's all about cancer. But for exam purpose, don't focus much on the treatment. Just focus on the types of cancer. That's very, very important. Stages of cancer. You should know what is angiogenesis, what is metastasis, when it's a benign cancer, when it is a malignant cancer. Okay, apart from that, you should know certain reasons about the carcinogens, about the physical, chemical, and biological carcinogens of cancer, and about the symptoms of cancer, which I already told you depends upon the part of the body which it affects. Okay, so I think according to that you can remember. So if a question is asked as a full mark, you have to write down accordingly to the points so that you score good. So that's all about the cancer. I'll meet you soon with the next video where we'll be talking about few more things. I don't know what will be the next video, but I'll meet you soon. But yes, surely I'm going to try to upload most of the important questions for your board exams, because I know colleges may prelims shuru ho gaye hai, and many of the boards like are going to happen in February, March, April, whatever the time is. Postponed hoga, nahi hoga, we don't know anything, but still there are certain states where there are exams in February. So I will try to upload the most important questions from chapters, okay, in the form of shorts so that you can refer and you can study. Okay? So I'll meet you soon with the next video. Till then, bye everybody. Take care and work hard and work for your dreams, because your dreams are the most important thing. Bye. Take care.